So my question is, I don't know what the price would be for monthly supplies of birth control. Is it fairly expensive without insurance?
It could vary tremendously. There are a lot of products on the market. So, but certainly places like Target or Walmart have been offering people like $4 a month pills for a long time. There might be options that the pharmacist would have for public health pricing, depending on who was purchasing it, which could be, so birth control pills can be purchased extremely cheaply. Sometimes patches and rings can be more expensive, but there's a variety.
But if a person didn't have insurance, of course, they could probably pay. And you mentioned cultural competency, and I know we have passed legislation with regards to LGBTQ cultural competency for providers. So would you be extending that beyond that? What cultural competency would you be referring to?
Yeah, I think there should be perhaps like a mandatory assessment so that like pharmacists can be aware of like their level of cultural competency in referring to like LGBT groups and like a lot of other groups that have been traditionally marginalized when like accessing healthcare. So I think it should definitely be more comprehensive, and I think that like an assessment in the initial stages of like providing contraceptives could be a good first step.
And
I was going to say, to sort of piggyback on that and to sort of echo my co-testifier's comments, is that maybe could be involved in some of the, I don't know what the training would be for pharmacists to then take on this new step, but maybe that would be a component, because as people who provide health to teenagers, even if you say that's a different type of cultural competency that we're specifically trained in. And so it would be great to have that kind of specific training if that's one of our most at-risk populations that we're trying to access here.
Mm-hmm. And there are jurisdictions, I know, for example, New York City, and there are groups here in the district like the Young Women's Project and other groups that have gone to healthcare centers to assess their level of teen friendliness. And so measures of that have already been developed that could be incorporated.
Thank you. And do most of the clients that you serve, do they have health insurance?
Most are on Medicaid, so they would be able to access hormonal contraceptives. But as I mentioned, a lot of people don't feel comfortable going to a doctor because they're very stigmatizing generally. And so this would reduce some of those barriers.
Thank you. Well, that would be up to, but you encourage through your organization to tell people to definitely go to a primary care doctor.
Yes.
Thank you. Councilmember, do you have any questions for the panel?
I didn't initially, but you may have already asked this, so forgive me if I'm repeating the question already posed by Councilman Alexander. But in the testimony, in the HIPS testimony from Ms. Fisher, I believe it was, you mentioned in your recommendations, clarify what mandatory referrals consist of. Was that the line of questioning that you all were just going back and forth, or I want to give an opportunity for you to actually talk about that, if you could?
In terms with sort of what would qualify as a mandatory referral?
Yeah, you said the bill mandates referrals to a primary care provider or clinic, but does not indicate.
My take on what you were saying is that the legislation indicates that if someone comes in and they either don't meet the criteria, or they don't have a doctor, or if they get contraception, that the pharmacist would recommend to them that they go to see a provider. Mm-hmm. And I think your testimony was saying, trying to clarify, would there be a requirement that that person do that? Would they be somehow tracked to do it? Okay. And that would not be a good approach, because people may have reasons why they can't actually follow through on that referral. Gotcha. I think that's how I took that.
Okay. So okay, I think I understand. Okay. Did you want to add something to it? I'm sorry.
Just that I interpret that some of the mandatory referrals is specifically if they're saying you don't meet the criteria for oral contraceptive pills, for the very few criteria that people would not be able to be eligible for oral contraceptive pills, then they would have to see a doctor. I think was part of that, but in order to obtain some type of contraception.
So what would be the screening for the pharmacist to ask an individual who came in and requested birth control?
So when someone comes to see me in my office, or when I talk to teenagers in their middle school, I talk to them about their health history, their family history, their allergies, and then I talk to them about specifically blood clots. That's the thing we worry the most about. But as we all know, blood clots have a higher risk of occurring in pregnancy than any type of oral contraceptive
And if
pill.
you smoke?
If you smoke, if you have high blood pressure. So all of those are included in sort of the medical and social history that we take no matter what.
And how often would a young person be able to answer those questions without an examination?
Oh, most of the time, most of the young people, if we're talking about teenagers, it's very unlikely that they have one of those complications. And there have been some studies, which I'm happy to send, that have looked at women's ability to self-screen using these kinds of checklists. And they actually find that women are more likely to over-report rather than under-report. So it's pretty unlikely that a woman say, no, I've never had a blood clot if they had one. They might be more likely to say, oh, I'm not sure, I think I might have had that, and not get the contraception than they would be to get it if they shouldn't have it. And there's also good data that shows that teenagers in particular are very unlikely to have medical contraindications to these methods.
Thing I just would like to add is in my discussions about contraception, especially with teenagers, but with everyone, I always assess for the ability of the method to work for them in their life. So someone who can't remember, has a variation in their schedule, like I work sometimes at night, sometimes during the day, taking a pill at the same time every day is maybe not the best method. So part of also not eligibility criteria in terms of medical eligibility, but in terms of finding the best method is also a critical part of that discussion as well.
And just in closing, would it be more likely for a teenager to go to a doctor or a pharmacist for birth control? Do you think they would go to a pharmacy for birth control?
I think if it was over the counter, they would be more likely to go than if it was a pharmacist or a provider, honestly, because I think, any person, there's a good amount of teens who just don't necessarily want to talk about this with anyone. So I think that that's a potential barrier. But I do think that there's also, we talked about effectiveness. We've talked about, if we can remember to take it. I think there's also a lot of good evidence that the best method for any person is the method that they choose, and that they are the best judge of what's going to work for them. And so I think that this is just a part of that.
And while we're focusing on teenagers, I know this would be greatly convenient for working women, for women who travel, to have it with
exactly.
them.
So from the pediatrician perspective, we take care of babies and children and teenagers, and, moms are critical to that. And so I think from looking at it from that perspective, for moms who might be older, this is a great option.
A great option. Councilmember McDuffie?
Just one more question along the same lines of the question I asked earlier, just to make sure that I'm clear. When I read, I want to make sure I'm talking to the right person. Whose testimony? Okay, all right, perfect. And you all can weigh in, but I just wanted to make sure because I came in a little late, so I wasn't sure if you all were seated in the order on the agenda. But again, it says the bill mandates referrals to a primary care provider or a clinic, but does not indicate whether the individual is required to then go to a primary care provider or a clinic for hormonal contraceptive refills, etc. The bill actually says in the draft that we're considering, it says the standard procedure protocol shall require the following, and skipping down to Roman numeral 2, that the pharmacist refer the patient to the patient's primary care provider, or if the patient does not have a primary care provider, to a nearby clinic upon dispensing a self-administered hormonal contraceptive pursuant to the subdivision, or if it is determined that use of a self-administered hormonal contraceptive is not recommended. What precisely is the concern that you have with that paragraph that we should be trying to address? Is there anything or no?
I think the concern is that because some people don't feel comfortable going to a clinic or a primary care provider, that they should not be required to if it's determined that they cannot access hormonal contraceptives.
Oh, okay. So that's not our intent. And so I'm glad that we clarified this. But what it is intended that the pharmacists make the referral.
Okay.
And I don't think anybody has a problem with that, right? Okay.
But can I just be clear, the bill, a referral, when we think of a referral, we think of a formalized referral that you go to Dr. Jones on Tuesday. This, in this legislation, simply states, we strongly advise that you should go see a doctor.
So it's
so that's not really a referral. That's more like a recommendation.
Well, and it doesn't say referral technically, and so perhaps I shouldn't use that phrase just to confuse anybody. It just says that the pharmacist refer the patient, and it might be confusing in a sense that we think about
very confusing.
Doctors saying a referral. So that's not what we intend. So appreciate you all raising that point.
Thank you.
Yeah.
Thank you all for your testimony.
Thank you.
I'd like to call up our next panel, Charles Hawthorne.